Guide, guidelines for measuring vital signs are going to be familiar with normal ranges for vital signs. The variable is based on different age groups and sex. Make sure equipment is in proper working condition. This ensures accurate readings. Guidelines for measuring vital signs. We want to eliminate or minimize factors that affect vital signs. Examples: exercise, food and beverage consumption, and emotional state. When a patient comes into the office, the majority of the time they are nervous. They do not want to be at the doctor's office. Usually doctors mean we're ill, and that's nothing that any of us want to be. So a lot of times when patients come into the office, they are apprehensive, nervous, anxious. So it's good to bring them into the office and let them, when you get them back in the exam room, let them sit for a few minutes to get everything to calm down. You're going to use an organized approach when measuring vital signs. If all the vital signs are ordered, usually start with temperature, follow up with pulse, respiration, blood pressure, and pulse oximetry if it is ordered. If a patient comes into the office and they do have a respiratory issue, if they have an illness that is a chronic illness, you are always going to want to use the pulse oximetry on them. So, body temperature, that is maintained by the hypothalamus. It functions as the body's thermostat. This will only allow temperature to vary from 1 degrees Fahrenheit to 2 degrees Fahrenheit throughout the day. Temperature maintained through a balance of heat produced in the body and heat lost from the body. Constant temperature range must be maintained for the body to maintain properly. When minor changes in temperature occur, the hypothalamus senses this. It makes adjustments so temperature stays within the normal ranges. Example, playing tennis on a hot day. The body's heat cooling mechanism in perspiration occurs to remove excessive heat. Heat produced through voluntary and involuntary muscle contractions. What is a voluntary contraction? This is what we can control. This is movement, us moving our arms. Involuntary, this is what we cannot control. This is digestion, the beating of our heart. When we're sleeping, we do not wake up to remind ourselves to breathe. This is something that is going to that's going to happen and we have no control over. Cell metabolism, heat produced when nutrients are broken down in the cells. Fever and strong emotional state. Heat loss, heat is lost through urine and feces, moisture droplets from lungs, perspiration, which is excretion of moisture through the pores of the skin. When moisture evaporates, heat is released and cools the body. Heat is lost through radiation, transfer of heat in the forms of waves. Body heat radiates to cooler surroundings. Conduction is the transfer of heat from one object to another. Direct contact, heat transferred to a cooler object it touches. Convection is transfer of heat through air currents. Cool air currents cause body to lose heat. Body temperature ranges. The purpose of measuring the body temperature is to establish patient's baseline temperature, monitor an abnormally high or low temperature. The normal temperature ranges is going to be 97 degrees Fahrenheit to 99 degrees Fahrenheit. Our average body temperature is 98.6 degrees Fahrenheit. Usually in the United States, this is recorded in the Fahrenheit system. Alterations in body temperatures, the fever, which is a pyrexia. This is above 100.4 degrees. Heat being produced is greater than heat being lost. A low-grade fever is 99 degrees Fahrenheit to 100.4 degrees. Hyperpyrexia is a fever above 105.8. This is a serious condition, generally fatal above 109.4 degrees. Hypothermia is below 97 degrees Fahrenheit. Classified as subnormal. Heat being lost is greater than it's being produced. Person usually cannot survive with a temperature below 93.2 degrees. The normal fluctuations occur throughout the day. Factors that affect body temperature are age, infants and young children, higher temperatures than adults. Heat regulating the thermoregulatory system has not yet been fully established. Elderly are at a lower temperature because of the loss of subcutaneous fat, lack of exercise, and loss of their thermoregulatory system. Factors that affect body temperature, the diurnal variations. This is during sleep. The body metabolizes and muscle contractions slow down. This causes temperatures to be lowest in the morning. Emotional states. Strong emotions increase temperature. Crying, extreme anger, rushing to get to the doctor's appointment. All of this takes into effect in their emotional state will run higher. Infants, young children often cry during examinations. And the environment. If it's a cold weather, this is going to decrease the temperatures. If it's a hot weather, it's going to increase body temperatures. Factors that continue to affect the body temperature: exercise causes increase in voluntary muscle contractions. This elevates the body temperature. Patient's normal body temperature. Some patients normally run low or high temperatures. In pregnancy, the cell metabolism increases. This elevates body temperature as well. So a fever, common symptom of an illness, particularly inflammation and infection. Febrile is a person who has a fever, and this is going to be above 100.4. Afebrile is a person who does not have a fever. A pyrogen is any substance that produces a fever. This is going to include pathogens. This resets the hypothalamus, causing temperature to increase above normal. Most fevers are self-limiting. Temperatures return to normal after disease process is completed. Stages of a fever. We have an onset. This is when the temperature begins to rise. It may be slow or it's going to be sudden. Patient often experiences coldness, chills, and an increase in pulse and respiratory rate. During the course of a fever, the temperature rises and falls in one of three patterns. Continuous, which body temperature fluctuates minimally, always remains elevated. Intermittent, where the body temperature alternately rises and falls, at times returns to normal or even becomes subnormal. And the remnant, this wide range of temperature fluctuation occurs, all are above normal. During the course of a remnant fever, this increased pulse and respiratory rate, feels warm to the touch, may also experience flushed appearance, increased thirst, loss of appetite, headache, and malaise, which is a vague sense of body discomfort, weakness, and fatigue. Often marks the onset of a disease, continues through the course of an illness. This is when we automatically just do not feel well and we know something's going on. Then the subsiding stage. Temperature returns to normal, can return gradually or suddenly. Suddenly, it's going to be referred as a crisis. The patient perspires and may become dehydrated. We have some assessment sites to take temperatures. They are going to include the mouth, the axilla, the rectum, the ear, and the forehead. The site should have an abundance blood supply so that temperature of the entire body is obtained. Site must be closed as possible, mouth, axilla, rectum, and ear. This prevents air from interfering with the reading. The site chosen should depend on the patient's age, condition, state of consciousness, type of thermometer available, and medical office policy. Oral temperature. This is convenient and one of the most common routes. When the MA records the temperature, physician assumes it is taken through the oral route unless otherwise noted. Rich blood supply under the tongue on either side of the femora lingua, the site for the placement of the thermometer. Patients must keep mouth closed to provide a closed space. The axillary temperature, which the axilla area is in your armpit. This is a recommended site for toddlers and preschoolers. It's also recommended for mouth breathing patients in patients with oral inflammation or oral surgery. This measures 1 degree Fahrenheit lower than the oral route, and you need to make a notation to indicate that the axillary route was used when you are entering this information in the EHR, which is the electronic health records. Then we have the rectal temperature. This is extremely accurate temperature measurement. Few factors can alter the reading. The rectum is highly vascular. It provides the most closed cavity. It measures 1 degree higher than the oral route. And you absolutely need to make a notation in the patient's chart to indicate that the rectal route was used. This is recommended for infants and young children, unconscious patients, mouth breathing patients, and when greater accuracy is desired. It should never be used on a newborn due to the danger of rectal trauma. Then we have the oral temperature. This is used with the tympanic membrane thermometer. The tympanic membrane is in your ear. That is your eardrum. Your ear is a closed cavity that is easily accessible, more comfortable for the patient, easier to measure temperature in children younger than 6 years old, uncooperative patients, and patients unable to have their temperature taken orally. Shall I keep going?
Nope, thank you. Is there? And that was the end of it. Fantastic. Thank you so much for sharing. That was fantastic. I know I could definitely say my emotional state would go up when I was a child heading to the doctor. That's for sure.
And adults are a lot worse than children are. They really are. Adults get scared. They see this white jacket, automatically, we're going to give you bad news. And you probably are absolutely healthy, but thinking that is going to make your body, everything raise, your pulse, your temperature, your
Right.
blood pressure.
I can remember a few times where they would redo it because I was nervous at times. So like they'd have to wait like 10 minutes. Like, okay, like come down, then you can proceed to do it again. I was like, okay.
Absolutely.
Yeah. So definitely remember being in those situations for sure. Okay. We had one student ask, what is Axillary? I think we might have went over that.
That is the armpit.
Okay, right. Okay.
So that's
Very
the
good.
armpit. And we like to do that in kids because you play a game. You have to interact with every patient, even older patients than you. You have to get on their level. So when we have the little ones, you have to play games with them because they don't want to keep their armpit closed. So you have to, pretend you're going to hug a monster, or you have to use your imagination. It's been a long time since I've had to do that, but.
Very good, very good. So just kind of give these prospective students an idea of knowing the knowledge is one thing, but then being able to practice them. So kind of give these students like a breakdown or maybe a visualization of how they would go about learning these practices in the classroom.
So we have a lab. I wish I could show. Can I show?
Oh yeah, definitely show everybody. Absolutely, please. Let me stop sharing my screen so we can get a better view.
So this is the lab. Here's my friend Frank. He's a little skinny at the moment. This is the lab. This is where the students sit. Katie, we need GoPros for this.
Oh yeah.
Yeah, that would work well. So here's where the students sit. Let me turn the lights on. I like to teach in the dark for some reason. We have oranges because this is how the students practice injections, is with fruit before they start sticking their students. This is what we do. But here is the lab. It's really
Pretty
hard
good.
for me to show you guys this.
You're doing great.
Here is where the students practice. We have exam tables that you would find in the doctor's office. Everything is set up just like a doctor's office would be. We have sharps containers. We do blood draws here. We do injections. This is our autoclave machine where we sanitize all of the stuff that we use. We have a centrifuger where we break our blood down. We have a urinalysis where we play with pee. That's the easiest way I can
You
say it.
say it.
That's it.
Very good. Oh, awesome.
EKG machines. We have scales. We have all kinds of fun equipment to do in here.
Great. No, I'm glad you were able to do that for us. I know carrying your laptop might have been a little workout for you, but
Yeah, that was
I just wanted to give the students kind of an idea of, what they're going to be doing. Like, yes, learning the knowledge part of the book part of it is very good, but also the practice part of it, I guess you can say. I guess there's a better word for it, right? Not just like
the clinical practicum.
clinical practices.
We're
Okay.
actually doing the applications. So we do blood draws. We do EKGs.
Mhm.
We teach injections, all of the vitals. What else do we do? We work with microscopes. We do some biology. We do some hematology. So it's really fun. We have a lot of fun. We even play games here. I have games called Scabs and Guts. So when everybody's brain is just ready to explode, we have fun and we play games.
No operation, right?
And we still learn. So that's the best part.
Good. It looks like here I have a question here. I'm a BDS graduate and like to know more about the clinical programs I could pursue.
Well, here we have the medical assisting right now.
Yep.
And the medical assisting, what that all entails is it's not a nurse. You are going to work in an ambulatory. Ambulatory means that we are able to get up out of our own house and walk into the doctor's office. It's not in a hospital setting where we are coming to take care of you. You're coming into us. It's more about prevention than it is treating acute emergency cares. So I kind of like this job a lot better because, and I have a lot of family that are nurses, and I'm not putting nursing down, but when people come to us, they're happy. They're not sitting in a bed miserable.
Right.
So you need to develop a really good bond with a lot of your patients, and you leave happy because a lot of times it's good. It's not bad stuff.
Right. The patients get to leave happy. So if that's a good thing, then it definitely works its way around. Very good.
Absolutely.
No, that's great. I feel like I kind of answered maybe some, as I mentioned, some job opportunity potentials. So that's kind of mainly where we're focusing at with the medical assisting program.
So right now, this is so interesting. I actually was able to place one of my students in an urgent care center.
Nice.
So she had that acute emergency atmosphere, which she really liked. And she worked 3/12. So it was more of a nursing hours, and she really enjoyed that. So
Great.
I do have an urgent care place, but the majority of the places are going to be clinic and doctor's offices. That's going to be a regular family physician, a specialty office, or it could just be clinics. There are flu clinics, COVID clinics, the injection clinics that I'm able to place people at as well.
Great. Awesome. I think that answered that question very well. Thank you.
Jared, it's more like a Monday through Friday, 8 to 5 job. It's more of banker hours.
Gotcha. I see. I like that.
Excuse me.
Yes, ma'am.
Yes, good morning. My name is Kushdeepkar and I'm from India.
Hello.
Hello. And I want to ask one question.
Go right ahead. Shoot.
Hello.
Hi.
Hi, ma'am.
How are you?
I'm fine. What about you?
I'm well. Thanks for asking. It's gorgeous out today, and we're going to have all kinds of fireworks here.
Okay. I want to ask one question. That I want to pursue with nurse assistant course. Then what are the facilities for that course available in your college?
it's kind of breaking up, but did you ask about a nursing assistant?
Yeah.
So this isn't going to be nursing assistant. We are actually a physician. We are assisting the physician. So we're not assisting a nurse. So it's not going to be at the hospital. And excuse my ignorance, and Katie, you might be able to help me, but is America the only one that really has like the hospital-based system and clinics with doctors' offices? I think that's abnormal in a lot of countries.
I honestly think that's beyond my knowledge. I have no, I cannot identify the differences between hospital and like urgent care or pharmacist.
I think in other countries, they have the hospital and the clinic is included into the hospital. And then that's where they would come for their follow-up appointments. We are going to be basically, patients are going to come walking in. This is like for more of a follow-up for problems that you're having, preventative. We're going to give you immunizations, make sure that your medications are corrected, any type of physical therapy, anything like that. So we're not really taking care of a patient in a bed.
Yeah. Okay, so that's great. That's today I have some basic knowledge about the differences between those programs.
Right. You don't worry, but I'm still figuring it out too. Don't worry about it. Just look for them in the white coats, right? Very good. This question is lastly, if accepted, is it going to be online lectures? I can say no, you do have to be in the classroom for the medical assisting program. If you want to further touch on that, Jenny, go right ahead.
Yes. So some of the classes easily could be done through Zoom. Absolutely. But when we get into the hands-on, has to be practical, I have to actually teach and touch the students to make sure that they're touching the right locations. If somebody could evolve these hands that I could put these gloves and could reach through, that would be great. I think we're a little bit behind in technology to get that multi-dimensional gloves, but I actually have to teach my students. That's why I was so excited, and Katie can vouch for me. I was almost in tears when I actually finally got to meet one of my international students, because now he's here. Now I can begin the application process of actually teaching him how to take care of the patients, because medical assisting is half hands-on with the patient and the other half administrative. So we're doing clinical things and administrative as well.
Very good.
I have to actually touch you. I'm sorry.
No, Matthew, I hope that answered your questions. Let's see another one.
Hello.
Hi.
Hello.
Hi. My question is, Davis College has a biotechnology program?
A pharmacy, did you say?
Biotechnology, I think.
Oh.
Yes, biotechnology.
That's not me. I think that's for you guys.
No, Davis College does not. They do not offer a biotechnology class.
And other colleges has.
I'm sorry, I think it broke up a little bit.
I am asking, and you know other colleges which biotechnology has program?
No, I do not. I don't know. I do not. I'm sorry.
Thank you.
Yes, sir. Last question here. It looks like want to ask how I can get to work in the U.S. Well, I would say by starting applying at Davis College would be the way to go. I don't know if Katie would like to touch on the admissions aspect of how to get into Davis College, and then that can further you to move on to then working in the United States.
Yes, I may cover this question. How can you work in the US as a student who is holding F1 visa, right? So as a student starting on F1 visa, you are only allowed to do on-campus job in the first year. After 1 year full-time studies, you can start off-campus job, if there's any, up to 20 hours per week. So to be simple, you cannot work off campus in the first year.
Okay, great, thank you. But then they can do the 20 hours, correct? No more than 20 hours after that year, correct?
Yes.
Can they volunteer? Can they do volunteer work? Unpaid volunteer work.
Oh, actually,
Like while they're here for the first year, would they be allowed to do volunteer services?
That's a great question. Let me.
yeah, I think that's something related to service.
That's a question I'm gonna get answers for you guys.
Because then if they're able to do volunteer work at a hospital, at something like that, that's a really good start to start networking, get their face and their name, you know, out there. That's the best thing with working in the healthcare. You have to network. You have to know people. I mean, you don't, but it's going to be a lot harder.
No, absolutely. The more you know, absolutely.
That's a very good point. You know, some students ask about the job opportunities, not only for money. They just want to gain hands-on experience.
Absolutely.
And it can be a network. Yeah.
I don't know if I'm allowed to disclose this, but I'm going to go ahead and let you guys know. ProMedica is one. ProMedica and Mercy are the two big hospitals around here, organizations. And I was just informed that ProMedica loves Davis students and never has to worry about Davis students because of the hands-on that they get in the classroom. They said that no other school in this area offers as much hands-on experience that we do in our clinical classes. So by the time the students get to their practicum class, their externship that they have to do, they can set them free. They don't have to micromanage them or watch them so closely because they're very efficient with what they're supposed to be doing.
That's
So
right. I've heard that a couple of times, even from our president, Diane Bruner. So I definitely have heard that before. And just to touch, go ahead. No,
I'm a
please.
Davis graduate as well.
Yep, great. So you know what it took and you know exactly how it's done, and being able to put that forth in teaching is even more remarkable. I just kind of wanted to touch base on, I know they're still asking about, you know, some clinicals they could pursue along the way, but, you know, with the externship, just to touch base on that really quickly. I believe it's for 1 quarter, correct?
It's 160. It's 160 unpaid hours.
Okay.
That they have to go and work at an office. While they're in the office, they will be doing front of the house, which accepts the patients, does all of the registration, insurance, all of the clinical aspect. Then they will take patients back and do the medical assisting portion of it. Vitals, minor office surgeries, anything to help assist with the doctor. Then they will have back of the house duties, which is checking patients out. So all of those different parts of the house, of the office, are really important. You want to make sure you check the person in. You want to make sure you get the copay. If their insurance has changed, if the insurance changed and you find this out afterwards, you're probably not going to get paid or reimbursed for that appointment.
Gotcha.
So then when you're taking the vitals, that's equally as important. When they're leaving, that's when you're going to potentially have to schedule appointments for different doctors. Maybe they're going to have an x-ray or an echocardiogram. So you're going to be responsible for doing that as well. So it's 160 hours. I try to match the student where they want to go. If they want a specialty, I try to get them into that specialty. I have 3 students right now that have been offered full-time jobs out of their externship.
And that's where I kind of wanted to hit home too, because you mentioned, you know, the more people you know, the connection. So with this externship, it really is big. So when you get to that position, you know, they could, once you finish your 160 hours, they can then offer you a position to then work for them. So
And
it's just
that is my goal, to get every one of my students a job offer out of it. Absolutely.
And that's what I wanted to really hit home. So that's great. it looks like Katie, you answered the question of the how would they apply for Davis College. I see you added the form site link below and kind of the step-by-step what you'll need to do. If does anybody else have any other questions for Jeni or Katie that we can get answered for you guys? If not, you can always email. I believe we can attach the emails below for Katie and Jeni if you have any other questions for them. And that would be it. Jeni, thank you so much for
Thank
coming
you.
along and showing us the classroom and doing everything that you do.
Thank you, guys. You guys have a great weekend.
Yep, you too.
Bye-bye.
Bye-bye. Katie, you put in your email down below. Beautiful. Thank you. Awesome. I'll go ahead and put mine as well, just in case anybody else has any questions. Please feel free to let us know how we can help. Everyone, thanks for coming. It's been a pleasure. We look forward to you on the next webinar, and we hope to talk to you soon. Have a good weekend.
Thank you. Thank you,
Thank
everyone.
you.
Bye-bye.
Bye.